Hello everyone, welcome to another question and answer session. This is the orthopedic expert. A 55 years old motorcyclist involved in road traffic accidents and sustained Gastillo-Anderson type 3 or type 3C type of the fracture to the distal tibia. He was wrapped in the wreckage for 7 hours, which time he bled profusely. From the fracture site, he has an established distal neurovascular deficit. What is the most appropriate course of the action? So, in this scenario, there are 2 or 3 important information. One of them is it is the road traffic accident. The second one, which is the most important, which is the Gastillo-Anderson type 3C. So, we have to know details about the Gastillo and Anderson type of the fracture. Then another important information, which is the 7 hours trapped in the wreckage, and there is profusely bleeding, and finally there is neurovascular deficit developed distal from the fracture. What may be the options? Now the options are amputation, skeletal traction, application of external fixator and arterial reconstruction, insertion of IM nail or intramedullary nail and arterial reconstruction, application of the plate of the tibia and arterial reconstruction. So first of all, let's see the classification of the Gastillo-Anderson for bone fracture. The Gastillo-Anderson, they are divided into the type 1, type 2 and type 3. In case of type 1, there is the wound size which is less than 1 centimeter. So which is very less. That means the Gastillo-Anderson in type 1, there is the wound is less than 1 centimeter. In case of 2, it is greater than 1 centimeter but it is less than 10 centimeter. And in case of the type 3, it is the more than 10 centimeter wound with soft tissue damage. So again, in case of type 1, it is less than 1 centimeter. In case of type 2, it is 1 to 3 or 1 to 10 centimeter, and in case of 3, it is more than 10 centimeter. So let's see. In case of Gastillo-Anderson classification, the 3 which is more than 10 centimeter, they are also divided into the 3A, 3B, 3C, or 3-1, 3-2, or 3. And here we can see in case of 3A, A is relatively better, that adequate soft tissue cover is present, and in case of 3B, inadequate soft tissue cover is present. And in case of type C, it is very dangerous, which is associated arterial injury. So Gastillo-Anderson classification 3, it is the associated arterial injury and wound size more than 10 centimeter. And in this patient, our patient, he was suffering from the type C. That means type C Gastillo-Anderson, that means the wound size is more than 10 centimeter and there is associated injury to the arterial system. So what will be our answer? Here we can see the answer will be amputation. Why amputation? So here this point is very important, which is the here his leg was trapped for the 7 hours. This is very important, because we know the normal viable time for the in trapped condition within the 6 hours. So when it crosses the 6 hours, the limb is dead. So this dead limb we should remove as early as possible. So our answer is the amputation. So when there is Gastillo-Anderson type 3C, that means it is the severe condition. That means the wound size is more than 10 centimeter. There is loss of soft tissue, and there is the arterial and nervous system injury, as there is severe injury. And here we can see there is a profusely bleeding from the side, and also the distal part of the fracture, there is the neurovascular status absent. So in this condition, the limb is a dead limb, so we should amputate the limb as early as possible.